I became a kinship caregiver at a very young age. I was only 24 years old, and I was notified through county that one of my siblings went into foster care. That was very difficult at the time because I didn't have the means to take care of her. I was still living with my parents, and that was hard to make that decision. I actually bought my first house, moved out on my own, and decided that I was going to take in my little sister, Krishana.
Jonathan had a really big effect on who I am right now. I think that even with deciding to live with him versus just going into foster care, it put me on two different paths.
What we know is that kids who live with kinship caregivers have greater placement stability. They do better with their physical, social, and mental health outcomes than kids who grew up in foster care.
If I would have chose to just go into foster care, I don't even know if I would have graduated high school.
Connect was started to make sure that kids did not grow up in foster care. Ultimately, what we've evolved to over these past many years is supporting kinship caregivers so that kids don't go into foster care. They can go right to their kinship caregivers, but if they are in foster care, that they're going to kin.
The focus of our organization is really about families and recognizing that all children and young people deserve to be with their family, to be with their kin, to be in their community and with their culture.
Being a kinship provider and being a kinship child, it really provides hope because it's saying my family didn't give up on me.
First step is finding the families. The second step is engaging them. And then the third step is supporting them.
Being a part of Connect during my time of taking on Krishana and just being a foster parent, they've been so supportive. Beds or food or clothing for the kids, and they've been able to really push me into the right direction and help me maintain. I think without Connect, there will be this disconnect for myself of being able to navigate the child welfare system. I got involved with Connect through Summit County Children's Services. They came and did a talk on kinship, and the room was silent, and I was the only one that was talking. You could tell that I was just passionate about it and saying, no, you have to be able to find kin, and it's important to be able to reach somebody within the family before we look at foster care as an option, because there's other individuals who are out there who may be able to take that child in, who may be able to provide normalcy.
Oftentimes, kids who experience foster care may be told or led to believe that there isn't anybody out there. On average, we find about 150 relatives per child. And our biggest genogram we've built is over 550 people who know the child by blood or fictive kin. These are family members, friends that know the young person and want to support them.
I don't think that your bloodline is what makes you family. I think it's the actual connections that you have, in which me and Jonathan definitely we're there. And so he is my family.
I really feel humbled to have been able to help Krishana. Like I said, it wasn't easy, it was very difficult, but it taught me to be the person that I am today, to love unconditionally. I really just feel blessed to have been able to be trusted, to give her the support that she needed at that time, and to see her grow. I'm just so proud of her.